Hello, my name is Dave Rakel.
And I'm Luke Fortney.
We are here in the UW Integrative Medicine program in the Department of Family Medicine. We're here to talk about evidence.
The evidence of mindfulness, which is a form of meditation, but more importantly than that, it's a basic human capacity just like reason. And we'll look at some of the research behind that, particularly with primary care.
Yeah. And evidence is good stuff.
It's very good. Yeah, it's very good.
You know, it gives us guidance. It's important. It helps us base what we prescribe on reality of what might be true.
And it helps us know what works and what doesn't work.
Exactly.
Yeah.
Our evidence is also a little skewed, don't you think?
Well, it's not the whole picture.
Yeah.
You know, there's Aldo Leopold has a saying that says, if the book about the goose and the goose disagree, always believe the goose. So we have to take it with a grain of salt and keep looking for more research and evidence to help guide what we do.
Consult the goose.
Consult the goose.
Another interesting thing is that, evidence, what we have evidence of what works is often profit-driven, That which gets the best evidence often makes the most money.
And with mindfulness, there's not a lot of incentive for that, because mostly what you're doing is free. You stop, you pause, and breathe.
Right.
Pay attention and have presence.
And healing people doesn't pay much, does it?
No.
It doesn't really reward the economics of medicine.
No, it doesn't.
If our incentive is disease care, but if we change our incentive to facilitating health, and that being our main intent, this will make money because it'll be quite profitable, because the money we save in facilitating health in another human being can be quite dramatic.
Very dramatic. And as we look at that, we also want to go through sort of the lineage or the history of how mindfulness came into medicine and primary care in particular, and see where it is currently and where studies are taking us potentially down the road, including a study that we'll be doing here in Madison.
Excellent. So Luke, will you take us through some of the evidence on how we can use mindfulness in our everyday practice of medicine?
Yeah, sure will. So Dave, what we have, as we talked about, was going through some of the key pieces of the literature and some research around mindfulness in medicine. And I'd like to go through some key studies that have come up over the last 15 or 20 years. So when we think about the relevance of mindfulness in daily life, this is a slide I like to use. This is a group of my friends. We were out on a sweat lodge in the Porcupine Mountains, out wandering about for a really long period of time. And as mindful as we were trying to be on this retreat, we failed to notice that there was a Yeti monster walking behind us the entire time.
Interesting friends you have.
Very interesting. Okay, so when we look at mindfulness, mindfulness-based stress reduction, as it's come out of the University of Massachusetts, defines this, or frames it rather, in a way that means paying attention with purpose, intentionally, in the present moment and without any judgment, or at least in a non-judgmental stance. And the practices themselves include sitting, standing, walking, talking, listening, working, eating, basically everything that we do. The whole point of this is to include it as a part of daily life.
And that's what we want to do in patient care too, is have our patient care be our meditation.
Yeah, right, and have our patient care, the clinical practice we do, the teaching, the working that we do to be a part of that. The practice itself, Sharon Salzberg is a nurse, a well-known figure with mindfulness. I love her definition about these practices. The skillfulness of it is the ability to let go again and again, over and over again. And my favorite definition of mindfulness is simply being with what is, just as it is. So that's the background of it. And as we move into the research, I like to use this study from the British Medical Journal by Smith and Company that looked at the effectiveness of parachutes in preventing major trauma and death related to gravitational challenge, noting that it hasn't been subject to rigorous evaluation, and it was inconclusive.
So it's a good example. Sometimes we spend too much time in our thinking brain and not enough time in our heart, where really what you're telling us is that we need to look at the research and combine the two.
That's right, yeah. Combine it with what's relevant, what's practical, and to use our own experience of something as simple as staying present, non-judgmentally, with intention. Seurat has this great painting. When we look at the research, I like to point out that each research study can't stand alone. We have to look at it within the context of all the other studies that surround it. Pointillism is a form of impressionistic painting that was used in the late 1800s, And basically what it is dots of the primary colors, so that when you really zoom in on it, you just see a particular color, but when you back up and look at all of them together, it gives you a complete picture.
So the research is maybe exploring the different colored dots, but the beauty is when we look at how we can apply the research to our patients' lives.
And our own lives, yeah, exactly.
Excellent.
So in 1992, one of the first studies, John Kabat-Zinn out at UMass took a mindfulness-based stress reduction group. These were people who were diagnosed at that point with the DSM-3 in the revised version with anxiety or panic disorder. And they put these patients through an 8-week course of mindfulness. And what they found was really interesting on different scores, that anxiety and panic were significantly reduced, and not only that, but it was able to be maintained over time, which was really interesting. In 2000, Teasdale and company looked at what mindfulness, in particular mindfulness-based cognitive therapy, can do for patients who are recovered but have recurrent depression. What they found was in this very large group of depressed patients who have it recurrently but are currently in remission, there was a significant reduction in recurrence of depression later in life. And this went over 15 months and had long-term effect. But those are one way to look at the psychological effects. And as physicians, we wonder too about some of the physical ailments. And fibromyalgia is one of these bridge diagnoses that can be really frustrating to treat and to have a diagnosis and live with. So a group in 1993 wanted to see how mindfulness might affect this. And what they found was 51% of the folks with fibromyalgia had a marked improvement in their symptoms, but largely many of the patients in this study had significant improvements. Another group wanted to look at a heterogeneous population of patients to say, what if we just took all comers, all kinds of patients, and we work with them over 8 weeks using mindfulness to see what kind of effect that'll have on well-being, physical symptoms, psychological distress, and is it lasting and does it stick? And sure enough, it did. It seems to be generalizable. So those are some of the background pictures, and as we move more into physiological effects, a psoriasis study that Kabat-Zinn did was very interesting, looking at that mind-body connection. This study, they took 37 patients with psoriasis, and they were randomized into 2 groups. Both of them got phototherapy. One group happened to be listening to audio tape of Kabat-Zinn's voice guiding them through some mindfulness practices. Then their target psoriatic lesions were looked at by 3 groups: unblinded nurses, blinded physicians, and then blinded dermatologists. And what they found was, at the halfway clearing point, in the complete clearing point, these lesions in the mindfulness group resolved 4 times faster. It's a mysterious process, but it's very interesting, and it was duplicated. Well, what about those folks, if we go to the other extreme, who've been doing this for a really long time? They like to call them the Olympic athletes of meditation. And in Madison, Antoine Lutz did a study where they took 8 experienced Tibetan meditators and looked at the brain activity of these highly expert meditators to see, in essence, what was going on, what could they observe in brain changes. What they found was, in the left prefrontal cortex, there was a high-frequency gamma wave synchronization. What that means is these were folks that seemed to demonstrate some kind of lasting change in their brain, presumably from their practice. And that kind of finding is connected with attention and mood, in particular positive affect and ability to focus.
So what this is showing us is that we can't all be Michael Jordans, but if we practice shooting free throws, we can make a lot more, and that might actually change the neural pathways in our brain.
That's right. And we'll look at a study on that very question in just a moment that shows, can we begin to learn these things, and how long does it take, with frequency, dose, questions such as that. This study took 13 Zen meditation practitioners, again, experienced meditators. These were lay meditators, people in the community, and they paired them up with 13 controls. And they gave them some attention tasks as well as MRIs, and they wanted to map out the gray matter, noting that as we age, gray matter dwindles. Something that none of us look forward to. And what they found was there was a decreased age-related gray matter loss in the meditators compared to the controls, and the meditators had better attention skills.
We can preserve our brains.
We can preserve our brains. And one of the areas in particular they found an increase in matter was the putamen, and that's an area of the brain that's connected with cognitive flexibility and attention. So this is the study I was referring to before. This was done right here in Madison. They had 48 participants. This was out at Promega, a biotech company out in Fitchburg. They split the group into a meditation group and a waitlist control, meaning these are folks that during the study wouldn't be receiving the intervention of mindfulness-based stress reduction over 8 weeks, but would be able to do it after the study. And what they found was that going through this 8-week course did actually begin to show changes like what we saw with the expert meditators. They were able to lateralize brainwave activity to the left prefrontal cortex. They had reduced negative affect. They increased their positive affect. And then Dan Muller, a rheumatologist in Madison, was part of the study, gave everyone a immunization of influenza at week 4, and they tracked that. And sure enough, like the Psoriasis Study, we saw that there was an effect on the immune system, the meditators having a more robust response to the vaccine. So what about using mindfulness as practitioners for ourselves? Does this have any effect on the patients we work with, residents and medical students we work with? Well, this study done in Germany, a randomized controlled double-blinded study, it was over 18 weeks, and they took 18 psychology interns in a hospital setting and looked at 124 inpatients. And they blinded it in such a way that the Zen meditation, which is a form of mindfulness, was being offered as part of their curriculum, and everyone would get it at different times of the year. And they also looked at patient impact scores as reviewed by blinded evaluators and the nurses and the patients themselves. What they found was the interns who were taught mindfulness as part of their curriculum, their patients had greater symptom reduction, shorter hospitalization, and they came to the conclusion that teaching mindfulness to residents can positively influence patient care. So that's an indirect way of using mindfulness.
Did they look at what effect it had on the interns?
They did, and it pretty much mirrored other studies with positive affect and reduction of negative affect. And again, similar to the work that we're interested in, we want to look at primary care physicians and the effect that mindfulness can have directly on us. So exactly your question is what this study by Epstein, Krasner, and company looked at in September of 2009 in JAMA. 70 primary care physicians offered a CME course on mindfulness over 8 weeks, and then looking at a number of survey and self-evaluations addressing well-being, burnout, and empathy. And sure enough, those things did correlate with improvements in those various areas. And as we know from the burnout literature in academic medicine 2009, that meditation was negatively correlated with burnout, meaning that it seems to be protective against it. So that's kind of a whirlwind tour as we look at all those different studies with the intention of emphasizing that mindfulness really is beneficial in that it has psychological and physiological effects, that it's a very simple modality, something we can offer ourselves and our patients, and that it has significance clinically for our patients' lives and for our own.
Yeah, it seems to be very powerful that the meditation brings us into the present moment with ourselves and with our patients, and it gets our mind out of all the chaos of thought of going too far into the future, too far into the past, and that may be part of the beauty of it, is just bringing us into the present moment.
And that's what this last slide really shows. This is a calligraphy piece of art by Thich Nhat Hanh, a mindfulness teacher. The whole point of doing this kind of work summarizes very simply into stopping, calming, resting as being preconditions for healing.
Thanks, Luke.
Thanks, Dave.